What do you tell family members when they come in and say, I've been hit or struck by my family member who has dementia, or they're suddenly very angry and hostile for apparently no reason? How do you tell family members, caregivers to navigate those challenging times?
Yeah, the first thing is to validate their feelings, right? First, are you okay? Did you get the care you needed? Did you need to be seen? Have you bandaged the wound? Are you bruised? First, checking in physically with them. The next thing is, do they still want to continue on this caregiving journey? Because for some people, being hit is too much. It's too much to ask. And if that's the case, then it's working with them to figure out how we can get other people to step in and do that work. Is it then placing this person in a long-term care facility? Medications, honestly, I know the FDA has not approved a lot of medications for dementia, but I tell people all the time, our brains are beautiful, amazing organisms when they're working right. And dementia is one of those diseases where it's not working right. And so when that happens, I can't tell your brain to behave differently, but medications can sometimes decrease agitation. They can sometimes change psychosis, because a lot of times people are agitated or aggressive because they are seeing things, hearing things, feeling things that aren't there, so hallucinations, or they have what we call these fixed beliefs. Someone's trying to hurt me, someone's trying to steal from me, what we call delusions. And so if I hit somebody because I thought you stole from me, well, that makes sense, right?
It does.
But if I didn't actually steal from you, then I, as the healthcare provider, have to see about working with medications and the family, depending on if they're open, to figure out a way to decrease that delusion. I tell people all the time, typically with medications, 3 things happen. 1, they get better, nothing happens, or they get worse. And so I really try to go in realistically about what the potential risk and side effects are, but I have seen some life-changing experiences with the right medication at the right time, at the right dose.
Now, one more point I want to make about this is what you just said about their brain is not working, and having to remind them that it's not willful, right?
Yes.
Their brain is not working. So that at least resonated with me. Do you find that that resonates when you talk about their brain, your loved one's brain is not working? Does that resonate?
I try to tell them it is not the person, it is the dementia, it is the disease. It's really hard, though, to step away when grandmother looks like grandmother or husband looks like husband and say, this isn't my husband, my grandmother doing this to me. This is a disease. But if we can sort of separate that a little bit, then I found that sometimes people are able to process it a little bit better because they do recognize it. But again, it comes back to really having good clinicians, good providers expressing to you, I know it may feel like they're doing it on purpose, but is it possible that it is this disease? Because I've seen in my experience X, Y, and Z.
Good information, accurate information from a trusted provider, and I'm sure your patients feel that way about you. So thank you.
Oh, you're welcome. You're welcome.